Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today, we have a special sponsored episode. I'm joined by Dr. Filip Dubovsky. He's an infectious disease physician, executive vice president, and chief medical officer responsible for medical and clinical affairs and related activities at Novavax. A recognized leader in vaccine development, Dr. Dubovsky brings more than 20 years of infectious disease experience to Novavax. Filip, welcome to the show.
Thank you very much.
Just briefly introduce yourself, share your story and journey to where you are today.
Right. So I'm a pediatrician, and even when I was training in pediatrics, I knew that my career was going to be in vaccines. I was the guy who volunteered weekends to be in the vaccine van to roll into areas of East Palo Alto to vaccinate the indigents then. And I went on after my training as a pediatrician, to do pediatric infectious disease at the Center for Vaccine Development at the University of Maryland. And after that, I went across town to Johns Hopkins, where I got a master's of public health and did a preventive medicine training residency. It was at the very end of that training when I was doing a externship at the NIH, when my boss asked me what I thought about malaria vaccines. And I told her, well, Regina, that's impossible. We can't really do that. And she challenged me to go read about it. So I did. And I read the literature and I said, okay, I think there's some leads here. There's some stuff we can do. And she says, great, because I just got a Gates Foundation grant. So we both quit our jobs, got some coffee tables in our basement, and started a nonprofit. And over the next 5 or 6 years, we were very successful in raising more money and doing a lot of really great work. We eventually joined PATH, which is a large international NGO, and we developed more than 25 vaccine candidates and took about a little more than a dozen into the clinic. After I did that, I further trained in developing vaccines. I had to join the commercial sector, the private sector, because that's where vaccines are developed. And I ended up joining MedImmune, AstraZeneca. And about 2.5 years ago, I came here to Novavax.
All right. And the majority of this interview, we're going to talk about a COVID and vaccine update. So we are talking in the middle of the fall, and in terms of COVID and the flu, what are experts anticipating this fall, and why is getting vaccinated for both COVID and the flu, why is that so important?
Right. So, we've known, the public health sector has known for decades that the best protection against influenza is vaccination. It's really the only way to go. And we've learned over the past 2.5 years that vaccination against COVID is critical. It keeps you from dying, it keeps you from going to the hospital, and it keeps you from getting sick. And that's really the goal. So as we know, in the fall, that's when flu comes out. And that's also where we are anticipating a spike in COVID. And we're already seeing this, right? We're seeing this in Europe. They're a little bit ahead of us. We're seeing this in the Far East. And there's some pretty stark statistics coming out of Europe. In the UK, the hospitalization rates increased by 45% over a week. So that's attributed to COVID. So I think we're looking at a pretty rough season. Whether we see flu and COVID at exactly the same time, no one really knows, because that hasn't necessarily been the pattern over the past 2 years.
After a few months of the pandemic, we've had a few different types of vaccines. Why is it so important to have more vaccine options for COVID and flu?
Yeah, the main reason is to drive use. If you give people choice about the products, they're more likely to take one than not. And that means that the entire endeavor of trying to increase vaccination rates is on the upswing. And that's really what we as a medical public health society are trying to do, is get the vaccination rates as high as possible to keep people from getting sick.
So as we speak now in the fall of 2022, in general, what is the vaccine uptake in the United States?
People are tired of the pandemic. Their behavior has changed. They're no longer masking, they're congregating now, but they're also not being vaccinated. And it's that lack of fear that is really leading to a decreased vaccination rates. I think, depending on what we see in the fall upswing, we may start seeing increased vaccinations. That's my hope, is people get vaccinated before the upswing, because that would allow them to be protected, obviously.
So do you think informing the public about these different vaccine options, will that increase the adoption of vaccines and boosters?
We hope so. And we have some data to support that. We know when countries where vaccines are available side by side on an even playing field, that people choose the various kinds, and they choose them for primary vaccination as well as for booster. So that's, I think, a reasonable goal, is to give people choice to increase vaccination rates. And it really allows them to look at the benefits and risks of each of the products and discuss it with their physicians and the public health advisors and make rational choices for what they choose to be vaccinated with.
So can you help us understand the differences in vaccine technologies that are currently available for COVID today?
Yeah, there are really two technologies that are currently available in the U.S. and have broad use. One of them is the mRNA technology, and the other one is a recombinant protein technology. Now, mRNA technology delivers the genetic message directly to the body, where it goes into the cells and it makes your body into a little vaccine factory. In fact, the cells express the spike antigen on their surface, and you generate an immune response against that. The other technology, recombinant protein technologies with adjuvants, that's a technology that's been around for decades. And what you do there is, in a factory, you actually make the outside spike protein of the virus in the proper three-dimensional conformation, and then you deliver it into the body with an adjuvant, which boosts the immune system against that. The benefit risk is positive for both these products, but they are different, and different people may look at various aspects of these and make choices about what they choose to be vaccinated with.
As a physician and researcher, what is your perspective on how the public has responded to the push for COVID-19 vaccination? And why do you think that is?
Yeah, it's really interesting. I mean, when we look back to the early days, people were frantic to be vaccinated. Long lines when the first vaccines first came out. There was a group of people who thought that things were moving a bit too fast, right? And they elected not to be vaccinated, called vaccine hesitant. And there are many reasons people choose not to be vaccinated. It could be one of a personal choice of having liberty and freedom to do as they choose with their bodies. It could be fear. It could be just lack of belief in science and technology or other things. That has really been compounded by the fact that people are no longer scared. So everyone knows someone who's had COVID recently, and it seems like it might just be a bad case of the flu, perhaps. But I think that's a misperception. And people are still getting very sick. They're dying. Now we know that you can get long COVID, even if you have mild disease. And even if you don't get long COVID, there's this whole host of sequelae, medical sequelae that can happen after you're infected, and after you're infected and you clear the infection that hang on for a while. So with the hope of preventing all those, as well as the hope of preventing transmission to your friends and loved ones and being a place where new variants can emerge, I think vaccination is a key.
So let's say I'm in the exam room and I'm talking to a patient who's a little bit hesitant about getting a booster because of some of the reasons that you mentioned, that there's this lack of fear. So you mentioned about some of the sequelae, long COVID symptoms. I think I just saw an article in the newspaper recently talking about long COVID. So tell me some of the messages I can communicate with that patient regarding some of that long COVID and other sequelae that is associated with COVID currently.
Yeah, I think one of the key messages is that you can get these sequelae. I mean, sometimes it's unclear to people. They think I have to get really sick before I can either get sequelae or long COVID, and that's just not factual. I mean, now there's a lot of literature which helps us understand that these things do happen. So even if you don't get very sick, you still could get sick in the long term. And the best protection against either immediate illness, which can still lead to hospitalization and death, is, as well as the sequelae, is vaccination.
So in terms of sequelae, what in particular, what specifically should patients be worried about, and what kind of specific long-term long COVID symptoms are we seeing currently?
Yeah, I mean, listen, a protein it is very broad. It's almost anything, and it's really hard to dissect out. But what we're seeing is a lot of cardiovascular sequelae. We're seeing things around diabetes. We're really all, you name an organ, and people have attributed some long-term side effects to COVID. We know that the virus can impact many organs throughout the body. The sequelae follow that as well.
And has the adoption of COVID-19 vaccines and boosters, has that changed the way the public views vaccines in general?
People were debating in the early days, lay people, whether they wanted a viral vector vaccine or mRNA or wait for a recombinant protein. And just based on the education they were getting themselves from the internet and from news sources and from the public health experts, there was a real lively debate happening out there among people. So I think people understand a bit more. They also misunderstand a lot. I mean, there's a lot of misinformation which is out there, and it's still out there now, both about the benefits and risks of vaccines. So I think that's one of the major differences. So now people are more sophisticated. They think they understand a bit more what the territory looks like, and that leads them to have choices in what they want to be vaccinated with. And my guess is it's going to spread to other vaccines as well. When you think about flu vaccines, there's also a broad range of technologies there that people can choose to make choices about which vaccine they receive.
Now, you mentioned misinformation, and as a physician who is on social media a lot, that's something that I try my best to do to combat. There's so much medical misinformation out there. Now, you work for a vaccine technology company. Now, what's most frustrating to you when you see all that misinformation about vaccines out there? What in particular is most frustrating for you?
You know, what's really frustrates me is this belief that vaccine companies are really out either to do harm or to do nothing but make a buck. And that's just not the way it works. I mean, if people were truly interested in only financial gains, they wouldn't be making vaccines at all. That's not really a very lucrative line of business. The people who make vaccines are people who are trying to prevent people from getting sick and dying. That's what I've spent my entire career pursuing, is different ways to keep people from being ill. Prevention is obviously better than treatment, and that's what we all work for. I come to work every day at a vaccine technology company, and I feel like I come every day to work on public health.
Do you have any advice or tips on how physicians like myself, how can we help clear up any type of misinformation that's surrounding COVID and vaccines in the exam room or on social media or in mainstream media for that matter?
Yeah, so I think there's a group of people who will maintain their mistrust no matter what. And arguing with facts and science is unlikely to sway the needle. I mean, we saw this back in the anti-smoking campaigns, where people brought rational arguments about disease prevention to the argument, and it didn't work at all. But when you started talking about it made your teeth yellow or it made you stink, then people started to kind of accept that or allow that to sway them. So there's a certain number of people that no matter how you argue science, it isn't going to work. There's an emotional appeal you can make. When I talk to people who have chosen not to be vaccinated, I point out the fact that I have, and my family has, and we've been vaccinated very aggressively because we don't want to be sick. We don't want to spread COVID to our family and loved ones, and we don't want to be, the person that breeds the next variant that can cause a lot of harm. So that perhaps can be helpful, a little personal touch, and showing that leading by example is always a decent thing to do.
Now, one of the things that I'm noticing, and perhaps you've noticed too, is that there's an increasing amount of distrust in terms of medical authorities out there. I'm seeing it all the time in my exam room where patients question sometimes the advice that I give them. They question the advice from, say, the CDC or other public health officials. What's your take on that? What's your comment in terms of this increasing public distrust of medical institutions?
Yeah, so some of it is facile collection of medical information. So you can go to your favorite search engine and you can put a term in and you can get a whole host of things that makes you feel like you're an expert, and including misinformation that's available on there. So I think that's one aspect to it. Living through this COVID thing, the messages that came out from the public health authorities globally were confusing and mixed. And it's because we started off knowing almost nothing. We knew nothing about the virus, how it behaved, who could be infected, how to prevent it. And that's how science works, right? You come in not knowing, and as you learn more, you change what you think to be truth. So naturally, the messages are going to change across 2.5 years of learning about COVID. So I think some of that may play into it. You hear this, at least I hear it, that, last week you said not to wear masks, now you're saying to wear masks, and now we don't need to wear masks anymore. So the evolution of science is being misperceived, I believe, as the lack of knowledge. And those are two very different things.
Today, we have a special sponsored episode. I'm joined by Dr. Filip Dubovsky. He's an infectious disease physician, executive vice president, and chief medical officer responsible for medical and clinical affairs and related activities at Novavax. Filip, do you think the pandemic is over? And if so, why continue to get vaccinated as we go from pandemic to endemic?
So we are going to eventually get into an endemic phase where we have disease without these horrible spikes. But a couple points. We're not there yet. The other point, I think, is you should never bet against the virus. So I've spent about 20 years trying to guess what's going to happen with influenza season on season, and I'm always wrong. It's not just me. Everyone's always wrong. And the point is that there's incredible evolutionary pressure for the virus to find a way to keep replicating. And as vaccines come into play, as people become immune, you're going to get escape variants. And these are the things which cause the next wave. And that's why there's this race to try to get on top of that with different vaccine technologies, either those that need to be updated to the new variants, or those that are more universal-like and appear to impact the variants without being updated.
Now, a lot of people look to our last pandemic in the early 1900s for clues going forward. So just looking at some historical context, is there anything that we can learn from that past pandemic that could predict the course of COVID going forward?
Yeah, I mean, that was a different virus, obviously, with different kind of features. Another flu pandemic back in 2009, was much less severe. That taught us a bit about how to respond to it. And my guess is that based on how we responded to the 2009 pandemic, we were able to rapidly respond to this pandemic. What you saw here over the past 2.5 years is something that's never been done before. And that's in that time frame, you've seen multiple really good vaccines being developed and deployed. Normally it takes 10 years plus to develop a vaccine. It's a long and laborious process. And what we've shown is with proper preparation and with proper resources, you can really accelerate the entire endeavor. And, this has been really life-saving for a large fraction of people globally. And it shows that as a humanity, when we pull together, we can get great things done.
What are some of the lessons that we can learn from the COVID-19 experience?
Well, I think the last one that I just mentioned, I think is a big one. This won't be the last pandemic. They come at unpredictable time gaps. This one isn't done yet. And until all the variants kind of calm down and we get into a more steady state, we really won't be out of a pandemic situation. But if we all pull together, if we focus on the public health need and deploy our resources against that, we can really do a lot of good. I think the other thing we learned is that people really did not respond very well to the pandemic. They didn't respond well to having to be at home. The social isolation was profound. The economic impact was very large. And the social isolation especially is profound on children and teenagers, where we've seen a lot of mental illness as their daily lives have been disrupted. And that's still ongoing as far as I can tell. So I think all those are features, and it's one of the reasons that we're going to really be able to be prepared for the next one that crops up.
What more can healthcare clinicians do to help educate their patients about the importance of vaccination?
Yeah, I think to remind people that, vaccination is a well understood technology and healthcare prevention system. We've been using these for decades, and think about childhood vaccinations and the life-saving benefits those have provided humanity. And this is just another vaccine. It's another vaccine which is against a respiratory virus, and we've already been vaccinated against multiple respiratory viruses. So this is just the next vaccine that we've had to develop to protect ourselves against a disease.
Now, looking into your proverbial crystal ball, what do you anticipate the next year or two to bring?
Yeah, so we've seen this interesting pattern in some places globally, where when we see a lot of COVID, we don't see much flu. But when the COVID starts coming back down from its peaks, the influenza flies up. So I think we're going to still have some unstable influenza and COVID transmission, which is going to be tricky for us to manage as far as getting the vaccinations right. And same with the booster doses. But eventually, I think people are so fatigued with COVID and the frequent boosting, we're going to be getting into an annual cycle, much like we do with flu. What we're thinking is going to happen is that we're looking toward an annual vaccination with either a combination COVID flu product or one jab of COVID on the right side and flu on the left side, or vice versa. Probably in the fall season, because that's when people crowd together, and that's where classically flu has had its biggest impact. It just makes sense to be able to vaccinate against two diseases in a single healthcare visit, whether it be at your pharmacy or at your physician's office.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
Yeah, so I'm a big believer in vaccination and vaccine technology. Now, prevention is obviously the right thing to do for any disease, and that includes COVID. I think we should all strive to find ways to get the message out there that people should follow the recommendations and be vaccinated and should be boosted. My children are vaccinated. I think children should be vaccinated. Even if you aren't scared of severe disease and death, it's no fun being sick, nor is it fun to be the person to transmit the virus to someone else. And these can all be prevented to some degree by vaccination. So you should go out there.
Philip, thank you so much for spending time with us and sharing your time and insight.
Thank you. It's been a pleasure.